way you solve complex problems is you take them piece by piece. This program, funding scholars to be exposed to primary care, to have opportunities to have impact in primary care, and to be exposed to leadership in primary care are simple things that we can do to expand the impact that we can have in primary care, and I think ultimately have a big difference in what we do in healthcare in general.
Motivational interviewing is an empirically based, patient-centered approach that when it's used in everyday provider-patient interactions, it elucidates better communication, better patient-provider relationships. There was a motivational interviewing introductory course that was led by myself. It was an hour and a half. I did patient surveys. After they saw clinicians that were trained in MI and then clinicians that were not. They were given surveys to assess how they felt about their care, if they were involved or if they felt like their provider was actually listening to them. I think motivational interviewing would be an excellent way to communicate with our patients, and I think it would be a great thing to incorporate in the CHCs in the future.
It was the Healthy Weight and Wellness program at the Anthony L. Jordan Health Center in Rochester, New York. And the concept was to find patients referred by their physicians or clinicians that at least had a greater than or equal to 25 BMI, as well as 1 to 2 weight-related chronic conditions or symptoms. Because it was a group medical visit structure, and that's the nature of this program, limited amount of time is provided for that visit. We need to figure a way to kind of make sure everything moved at a pace to allow the time for the consultation with the physician, as well as for the actual group program. So we actually developed an EMR template to be able to use, as well as like making billing easier. That was a whole discussion.
There's significant literature that says that a lot of people, especially in underserved populations, have some sort of mental health issues, especially within the obese population. So especially for me, I did a little more research, and the idea was like, well, is it really the mental health that's impacting their obesity, or is it the obesity that's impacting their mental health? So I called each patient and I was able to troubleshoot with them and say, these were the goals that you set up for last week. How are you doing with those goals? If they weren't able to achieve the goals, I literally sat for as long as it took and I said, let's figure out a way for you to be able to achieve those goals. One example I wanted to give was one lady who had said that she had really had a hard time increasing her exercise. That's something she wanted to increase. And so I asked her the type of things that she liked to do in her house, and she says, well, I like to talk on the phone. And we had actually previously we had given them pedometers and said, try to achieve your 10,000 steps a day. And I said, well, if you're on the phone, just walk around your house. I'm pretty sure if you speak on the phone 3 to 5 hours, you might reach that 10,000 every single day. We were able to impact the way in which they screened for both anxiety and depression by dropping one whole clinical category. So for people who scored above 10 initially, the average score for depression dropped to about an 8, so about a mild level of depression.
We were tasked with the responsibility of identifying facilitators and barriers to the implementation of an online bilingual English-Spanish patient portal within Altamed's predominantly Spanish-speaking safety net population.
We administered 400 patient interviews with an 83% response rate and 59 provider surveys with an 80% response rate.
When asked about their preferred method of communication with patients, 75% of providers indicated preferring phone contact over asynchronous means of communication like email or secure messaging through the EHR. In fact, our survey data indicates that providers may benefit from a more efficient means of communication, with about 69% of providers indicating that they play phone tag with their patients several times per week. Asynchronous communication may offer the necessary alternative means of communication to remedy the situation.
Patients were generally in favor of the portal, with 72% believing it would strengthen their relationship with their provider and 77% reporting that it will improve their overall quality of care.
The JWCH Institute was looking to implement a patient portal where patients can log in and have greater access to their own personal health record. However, implementation of patient portal is not without its own difficulties, and especially at the clinic that I was working at, the Center for Community Health, that clinic serves a primarily homeless population. So my project essentially was to assess the technological capabilities, the socioeconomic barriers, and the willingness of that population to use a patient portal in managing their care. I developed a 28-question bilingual questionnaire in both English and Spanish, and it collected a lot of information on demographics, on technological accessibility, particularly with computers and mobile phones, and technological skills, and also the willingness to use any of that in managing their care. My recommendations include offering quick hands-on technological lessons in the waiting rooms while patients are waiting to see their providers, as well as collaborating with transitional housing programs on Skid Row to teach patients how to sign up for an email and how to use that email to sign up and navigate the patient portal. Given that there are many unmet health needs and a lot of medical complexities within this population, implementing a patient portal might be a really critical step in improving the health outcomes of these vulnerable populations. So, thank you.